my name is Dr. Sari Harenwall. I'm a clinical psychologist and work in the COVID rehab programme for staff in Bradford, Airedale and Craven in the Primary Care Wellbeing Service, Bradford District Care Trust. This talk is part of a short series of how to support your mind and body in the recovery and management of long COVID. This video is focused on what is long COVID and understanding long COVID. So the NICE rapid guidance came out just at the end of 2020, and they've defined and categorized COVID-19 in 3 ways. So firstly, acute COVID-19 are signs and symptoms of COVID-19 for up to 4 weeks. Secondly, ongoing symptomatic COVID-19 are those symptoms lasting between 4 and 12 weeks. And lastly, post-COVID-19 syndrome are signs and symptoms that continue for more than 12 weeks and are not explained by an alternative diagnosis. And both ongoing symptomatic COVID-19 and post-COVID-19 syndrome are the ones that tend to be talked about as long COVID in the media. What's important to know for people with long COVID is they usually present with clusters of symptoms. They're often overlapping and can fluctuate and change over time, and they can affect any part of the system in the body. And because of that, it can be quite frightening, and you might feel worse 1 week after you've been feeling better. But this is important to know is normal part of the pattern. So secondly, we will go through some of the common symptoms, although there are many, many more that are described. These are some of the most common ones described in the NICE guidance. Breathlessness, cough, chest tightness, chest pain, palpitations, fatigue, fever and pain, different cognitive impairments such as brain fog, loss of concentration, memory problems, headaches, sleep disturbance, and neuropathic symptoms such as pins and needles and numbness and dizziness, abdominal pain, nausea, diarrhea and loss of appetite, joint pain, muscle pain, symptoms of depression, anxiety and post-traumatic stress, tinnitus, earache, sore throat and loss of taste and smell, as well as skin rashes. So what does the research tell us about these symptoms and what people experience? There's a study from Leeds in 2020 that found that 72% of people in the ICU and 60% of those who were on a ward experienced new illness-related fatigue. That's quite a huge number. And a large number experienced breathlessness, so that was 65% in ICU and 42% on the ward. And psychological distress was also highly reported, 46.9% in ICU and 23.5% on the ward group. So we know that people tend to experience symptoms for much, much longer than the initial period of illness. And it's estimated that up to 10% of those experienced COVID go on to develop long COVID. And it's important to know that it doesn't matter if you had mild or severe symptoms or no symptoms at all, you can still develop long COVID. I also wanted to share a little bit some of the preliminary research data from our own surveys as part of our programme. This is people who have self-referred onto a long COVID 7-week course, and we found that out of those attended, everyone experienced increased fatigue they attended, and their severity rating was 7 out of 10, 10 being the worst, so a really big impact. We also found that only 10% reported that they had no anxiety or depression. Nearly 30% had slight anxiety and depression, and 60% had moderate to extreme levels of anxiety and depression. 38% reported symptoms consistent with post-traumatic stress. 80% reported short-term memory problems. 69% reported a negative impact on work, and over 60% reported breathlessness. 94% reported a decline in overall health with an average of 43%. So these symptoms are common, as you can hear, and this is from a local population of self-referred long COVID patients. So what causes post-viral fatigue? Well, we know it's always caused by a virus, and it might be related to, and these are theories, so it might be related to an unusual response to viruses that remain latent in the body. It could be increased levels of pro-inflammatory cytokines, which promote inflammation, or nervous tissue inflammation. So even though we don't know a lot about long COVID yet, because we've only known about it for the last 12 months or so, we can still learn from other data how this impacts on people. We don't know how long it takes to recover from post-viral fatigue, but there's some interesting studies in related areas that are important to highlight. So a small study in Norway predicted early diagnosis is likely to improve recovery. And a study in Australia looked at people with glandular fever and other viruses and found that a lot of people experience disabling fatigue, musculoskeletal pain and neurocognitive difficulties, as well as mood disturbances in 12% of their sample, and 11% ended up meeting diagnostic criteria for chronic fatigue syndrome. There was a study in 2009 about the SARS virus a year after the outbreak in Hong Kong, and they found that 40% of their sample had active psychiatric illness, and 40% reported some degree in chronic fatigue even a year after, with 27% meeting diagnostic criteria for chronic fatigue syndrome. So this might not help a huge deal to be told that actually we don't know how long it will last. It varies from person to person. But we do know a little bit about what can help. Many people, and most people, recover spontaneously with holistic support and rest and gradual increase in activity. We know that the body has a great power to heal itself. So we've put this series together of easy to follow self-management videos covering most of the common difficulties experienced by people with long COVID, including sleep, breathing, managing stress, fatigue, and diet, amongst others. So we know by optimizing your life in those areas, by taking it slow and learning from your body what it needs, we believe that that will lead to better management of the symptoms and better chances of recovery from long COVID.